Well, today we'll be talking about the drug AMIODARONE. It is a very versatile drug commonly used in anesthesia, ICU, and cardiac operating theaters. So, let's get started. Now, first comes the structure. So, structurally, AMIODARONE is an iodinated benzfuran. That is, it has iodine in its structure. So, you can remember an IO here and an IO there. So, there's the first and the second iodine in the AMIODARONE molecule. It is a benzfuran, that is, it has a benzene ring and it has a furan ring. So, benzene is a 6 carbon atom ring. Furan has 5 members in its ring. It's a 5-membered ring with 4 carbon atoms plus 1 oxygen atom. Structurally, it bears quite a resemblance to the T3 and T4 molecules in a body, which will be useful later on when we discuss the side effects. Now, coming to the mechanism of action, it is classified as a class 3 antiarrhythmic agent under the von Williams antiarrhythmic agent classification. That is, it acts on the potassium channels, it closes them, it increases the period of repolarization, therefore increasing the refractory period of the cardiac tissue. Here it acts primarily in the repolarization phase. It also has other mechanism of actions, that is, it acts on the sodium channels, the voltage gated sodium channels, more so in their inactive state, therefore decreasing the velocity of this phase 0 upstroke. It is a non-competitive beta blocker and a non-competitive calcium channel blocker, mainly acting on the L-type calcium channels. So because of its multiple modes of mechanism of actions, it is helpful both in atrial as well as ventricular dysarrhythmias. Coming to its preparation, so it can either be in the form of tablets or it can be an IV drug. So when the IV preparation was being made, it was highly unstable as an aqueous solution. So they needed a stabilizer for the same. So that's when they came with polysorbate 80. So polysorbate 80 is now used as the stabilizer in all the IV preparations of amiodarone. So for every 50 mg of amiodarone, it has 100 mg of polysorbate 80 and 20.2 grams of benzyl alcohol in it. Moving on, the route of administration, it can be oral or IV. The oral route has a very slow delayed onset of action and IV is faster. Bioavailability ranges between 20 to 80%, with the GI absorption is a bit erratic. The plasma protein binding is about 96 to 98%. It is distributed highly throughout the fats, in the liver, and in the lungs. So it is a highly lipophilic drug with a very large volume of distribution going on to about 66 liters. So the elimination, it has a very short initial half-life. The drugs get redistributed in the peripheral tissues and a longer later half-life, which spans to about 3 to 8 weeks depending on the concentration of drug that is administered. It is metabolized in the liver with the enzyme CYP3A4, which forms the activated metabolite, that is desethyl amiodarone, which is pharmacologically active and is excreted via bile. Now it's dosing. So during CPR, when CPR is going on, you go with the first initial dose of 300 mg IV and if required, followed by another dose of 150 mg IV. This is when patient has pulseless ventricular tachycardia, so ventricular fibrillations, is in cardiac arrest. If the patient has ventricular tachycardia with a pulse or a wide complex tachycardia, that is your QRS interval is more than 0.12 seconds. Then you go with the bolus dose of 150 mg IV, followed by an infusion of 1 mg per minute for the first 6 hours and 0.5 mg per minute for the next 18 hours. Moving on to the adverse effects. In CVS, it may cause bradycardia, it may cause heart blocks, it may lead to hypotension. This usually happens on a rapid IV injection of amiodarone and is usually because of the stabilizer that is used, that is the polysorbate 80. CNS, it may cause peripheral neuropathy, ataxia, and tremors. It may cause pulmonary fibrosis, it may cause pneumonitis, but these effects, they are less likely if the daily dosing is kept less than 200 mg per day. Now the endocrine side effects. So since it has a structural similarity to T3 and T4, it may cause hypo or hyperthyroidism in the patients. So hypothyroidism is by the Wolff-Chaikoff phenomena because of the iodine molecules which are released during its metabolism. It also inhibits the peripheral conversion of T4 to T3. It also increases the reverse T3 enzyme levels in the body. Other side effects include patients who are taking amiodarone for a long time. They may develop cataracts, corneal deposits, and optic neuritis. It is also secreted in breast milk, may cross placenta, derange lefties, may cause cirrhosis in some patients. Now the contraindications. So if the patient has any known hypersensitivity against amiodarone, you don't give it to them. Patients who are allergic to iodine, patients who have a history of porphyrias, patients who are breastfeeding as it is excreted in the breast milk, then patients who already have a history of second or third degree heart blocks, patients who have increased QT intervals, you don't give amiodarone to them. Now, some additional points regarding amiodarone. So first is that we remember that it was metabolized by CYP3A4. So it also inhibits CYP3A4, so it may increase the concentration of drugs such as warfarin, phenytoin, atorva, or simvastatin, as these are also metabolized by CYP3A4. So it also inhibits P-glycoprotein. Now the function of P-glycoprotein is to pump digoxin out of the cells. So if you're giving amiodarone and digoxin concurrently, because it inhibits P-glycoprotein, it leads to increased digoxin levels. Then it also interacts with the PVC tubings. You know, the lines through which we give amiodarone, it interacts with the PVC tubings, and if those PVC tubings, they have DHEP in them, it will interact with them to release the phthalates. Now these phthalates, these are very harmful, especially to the neonates, as they interfere with the endocrine and the neurodevelopmental processes. So you have to make sure the line which you're giving the patient amiodarone through, it should not have DHEP in its composition. It is usually added to make the plastic tubings more pliable, more softer. Next, what you have to remember about amiodarone is that you should not give it through peripheral IV access as far as possible. So it is a highly acidic drug. Even after dilution, the pH ranges between 4.14 to 4.6. So if you're giving it chronically through a peripheral line, it may lead to phlebitis in the patient. So as far as possible, a central venous access is preferable. That's all. We'll just go revise it once again. So amiodarone, it is an iodinated benzphirin, structurally similar to T4 and T3 hormones. Mainly a class 3 antiarrhythmic agent, it closes the potassium channels, increasing the repolarization and refractory period of the cardiac tissue, but also has class 1, class 2 and class 4 actions. Now usually in the acute dosing, the class 2 and class 4 mechanisms are the ones that come into play, while when we're giving amiodarone chronically, it is mainly the class 1 and class 3 actions that mediate its antiarrhythmic effect. Next, the preparation. There is polysorbate 80, which acts as the stabilizer, given orally or IV, highly plasma protein bound, highly lipophilic, a large volume of distribution, metabolized in liver and excreted via bile, and also very long elimination half-life. Dosing, you already know. Adverse effects may cause bradycardia, hypotension on rapid IV injection, neuropathy, ataxia, tremors, hyperthyroidism in patients, pulmonary fibrosis, pneumonitis, cataracts, deranged LFTs, contraindicated in patients allergic to iodine, may having porphyrias or are hypersensitive, as it can cross the placenta and is excreted in breast milk, so you have to avoid it during breastfeeding. Right, also inhibits CYP3A4, so increases warfarin, phenytoin, atorvastatin, simvastatin concentrations, may increase digoxin levels by inhibiting P-glycoprotein. Make sure the lines you give it through, they don't have DHEP in it, so you don't release phthalates into the patient's bloodstream, and is highly acidic, so as far as possible, give it via central venous access. So that's all from my side. I hope you liked the video. If you did, like, share and subscribe. Have a good day. Thank you.